Hello, my name is Keisha. I'm going to be your nurse today. I'm going to do an assessment on the baby. I'm going to do hand hygiene, put on my gloves. I'm going to check the identity of the baby and then the identity of the mother. I'm going to listen to apical heart sounds for a minute. I'm going to check, I'm going to listen to lung sounds in all 5 places and bilaterally. I'm going to listen to abdominal sounds in all 4 quadrants. I'm going to palpate the abdomen, make sure it is non-tender and non-distended. Then I'm going to check the umbilical cord stump, make sure there's no drainage, no redness, and no bleeding. I'm going to check the temperature axillary. I'm going to check the skin. I'm going to check the warmth, the color, make sure there's no lesions, abrasions, and check to see if there's any birthmarks. Then I'm going to check the scalp and fontanelles to make sure they're soft and flat and make sure there's an even distribution of hair. I'm going to check the eyes. I want to make sure the outer canthus is in line with the pinnae of the ear. I'm going to check the sclera, make sure they're white, and the conjunctiva to make sure it's pink. I'm going to check the nose, make sure there isn't any respiratory distress. Make sure there's no nasal flaring. Make sure there's no congestion, any drainage. I'm going to check the lips and the mucous membranes to make sure they are pink and moist. I'm going to check reflexes. I'm going to check the rooting reflex. I'm going to check the sucking reflex as I pull my finger back out. I'm going to make sure the hard and soft plate have fused. I'm going to be checking the palmar reflex, the plantar reflex, the Babinsky reflex, and the moral or the startle reflex. I'm going to check the upper extremities. I'm going to check pulses in both. I'm going to check capillary refill in both and make sure they can move their upper extremities okay. I'm going to check the lower extremities. I'm going to check pulses in both. I'm going to check capillary refill in both and make sure they can move their extremities okay. I'm going to check the spine, make sure it's aligned, and see if there's any sacral dimples. I'm going to make sure the baby has a good strong cry and that the baby is responsive to stimuli. I'm going to check the diaper area if it's the female. If the baby is a female, I'm going to make sure the labia majora is greater than the labia minora. If the baby is a male and has been circumcised, I'm going to assess the site, make sure the anus is patent, check to see if there's any skin breakdown, and do some teaching to the mother that make sure that the baby will have 6 to 8 dirty diapers a day. I will ask the mother if the baby has had his first dark tarry stool, meconium. I will ask the mom about the characteristics of the voiding diapers, make sure there's no bleeding. Then I'm going to take off my gloves, do hand hygiene in here, put new gloves on.